Hey, hello. My name is Jenny and Katembong. I'm a nurse. I'm a staff nurse in the Philippines and also a licensed nurse in the United States of America. Well, I'm doing this recording for my reference, but also I'm also just going to share it to my fellow nurses who are looking for free certifications, free seminars, and for us to gain CPD or continuing education units. So let me just share some information for nurses in the United States. Okay, I have so many open files. For nurses in the States, the continuing education or CPD units depend on the state where you are licensed. For instance, I'm licensed to work in Nebraska and the required number is 20 hours. Whereas in the Philippines, I believe it's only 15 hours. Yes. Um, we're required here in the Philippines to continue to acquire continuing professional development or CPD units. Um, a total of 15 CPD units every 3 years, okay? Because our license is valid for 3 years. So I was going through all the different platforms, and what I've realized is that we can actually get a free seminar without paying for anything from American Nurses Association. If you're a Philippine licensed nurse and also a US RN nurse or US registered nurse, you may also try this one. So, because I was very curious, I logged in and um, became a member or started my membership with American Nurses Association. And then after having my membership approved, well, I haven't really paid yet, but to be honest, you can just continue on without actually paying for anything. I just wrote here my uncle's address. I haven't started my registered nurse job yet in the US, but for now, this is the information that I keyed in. So, one of the free topics that American Nurses Association offers is this one, antimicrobial resistance, the role of the clinical nurse. I paid $0 for this one. And it looks like this. So first it shows a table of contents, disclosure, disclosures. To receive credit for this nursing continuing professional development activity, you must complete all the required elements of the course as indicated within. Complete all activities by the expiration date. Okay. By the expiration, wait, I'm trying to annotate, but I can't. By the expiration date as published in the online catalog at the point of purchase or enrollment, complete and submit the online evaluation by the expiration date. The American Nurses Association is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Centers Commission on Accreditation. So if you're already a USRN, um, upon the renewal of your license, they will ask you to upload or to submit a detailed list of all the CPD units or seminars that you've attended. And this, of course, is required. It has to be developed by, or it has to be accredited by ANCCCA. Of course, American Nurses Association is an accredited provider of ANCCCA. All right, disclosure of relevant financial relationships. None of the planners, creators, or presenters for this educational activity have relevant financial relationship to disclose with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. The American Nurses Association does not suggest that there is real or implied endorsement of any product, service, or company referred to in this activity, nor any company subsidizing costs related to the activity. So I would just like to show you what it looks like. There's course content. Okay. And then, so general overview, the course content module consists of one learning activity and a verification of completion checklist. It is recommended that you navigate through the activities in this module in the order presented. Upon completion of the required activities in the course content module, continue on to complete the course evaluation survey and obtain a course certificate. Course navigation. From the table of contents, click on the menu items. So we have all these course navigation area. Okay. On the left side of the page, you gain access to each module, along with further course instructions to complete activity, learning activity overview. Completion of learning activity in the course content module is a course requirement unless otherwise stated. Please note that the learning activity module opens in a new window. If you're unable to view content, turn off the pop-up blocker to this site on your browser. Click here for more information and disabling pop-up blockers. Okay, so this is the module. Let's see if I'll be able to access it. All right. Content opens. All right. So now let's launch the course. I'm not sure how this will go. This is my first time to try this. I just discovered it today, so I just would like to share it with anyone who's looking for free seminars. Let's see if it'll work. Well, while waiting, I have a few more seminars that are $0 free, literally for anyone. And it has CNE credit expiration date. In my case, my license will expire in 2027. And so this course is literally acceptable and valid until then. Technology-driven care, data technology-driven care. 2020 National Nurse Month webinar. It will expire soon, but well, it's free, so why not? Creating your career path. I find this very interesting. Well, only if you are a ANA member. And the membership fee depends on your state. So for California, it's $15.75 per month, and the annual fee is $183. Okay, let's see. This is it. Let me see if I'm sharing the sound first before I click on the actual video.
Hi there, and welcome to Project First Line, Antimicrobial Resistance, the Role of the Clinical Nurse. Click Next to get started. Before we get started on the content, let's give you an overview of how to interact with this module. First, it is important to know that you can view a transcript of the slide's audio by selecting the menu icon in the top left corner of the player, and then select Transcript. Go ahead and try it now. Throughout the course, you may be presented buttons to click to show more information on a topic. Click on the topic buttons to display information. Notice that when you click on the topic button, the button will change color denoting that you have seen this information. Go ahead and try it now. When you are ready, click Next to move on.
All right.
This topic's information will be displayed, and there may be additional audio. Following this module, the learner will be able to describe the role of infection control in combating antimicrobial resistance, commonly referred to as AR, and identify 3 specific areas where clinical nurses can influence AR.
All right. Let's continue.
In this module, we will examine antimicrobial resistance and the role of the clinical nurse in combating antimicrobial resistance, so that you can implement these interventions in your practice. Meet Ann Miller. In 1942, she was a 33-year-old wife and mother who, following a miscarriage, developed a streptococcal bloodstream infection. Desperate to save this young woman, doctors at the Yale New Haven Hospital tried everything to save her life. A blood transfusion, hysterectomy, sulfa antibiotics, and even rattlesnake venom were used, to no avail. Ann Miller was dying. On Saturday afternoon on March 14th, for the first time in the U.S., an experimental drug called penicillin was given to her. Soon after, Ann's fever was normal for the first time in a month and she was eating. Ann Miller was the first person whose life was saved by penicillin. She lived another 57 years, dying at a Connecticut nursing home in 1999 at the ripe old age of 90. Her medical record is on display at the Smithsonian Institution.
Wow, that's very good.
The discovery of antibiotics was truly remarkable and changed the lives of millions of people. However, since then, germs have looked for ways to survive or resist the drugs designed to kill them. When germs develop the ability to grow in the presence of these drugs, this is called antibiotic or antimicrobial resistance. The terms antibiotic and antimicrobial are often used interchangeably, but the term antimicrobial includes drugs used to treat bacterial, viral, or fungal infections. So, how do germs develop resistance to antimicrobials? Bacteria and fungi can develop defense strategies called resistance mechanisms. This happens when bacteria and fungi develop new cell processes that avoid the antimicrobials' action. They can change the way antimicrobials enter the cell, blocking the antimicrobial. Germs can pump the antibiotic out of the cell before it kills the germ. They can also develop the ability to change or destroy the antibiotic. Germs can move the target within the cell so that the antimicrobial misses it. This bypasses the effect of the antimicrobial. When you see the suffix "ase" in a resistance mechanism, this means the bacteria has developed enzymes that inactivate antibiotics. Beta-lactamase-producing germs have the ability to inactivate cephalosporins. Carbapenemase-producing germs inactivate antibiotics like meropenem.
Okay.
In 2019, the CDC published a report underscoring the threat of antimicrobial resistance in the United States. Not only does the report tell us that almost 3 million antimicrobial resistant infections occur in the U.S. each year, and 35,000 people die as a result, but in the foreword of the report, the former director of the CDC, Robert Redfield, boldly implores us to stop referring to a coming post-antibiotic era. It is already here. He goes on to say, "You and I are living in a time when some miracle drugs no longer perform miracles, and we can no longer rely simply on developing new antibiotics." Antimicrobial resistance affects people, animals, plants, and our shared environment. It is referred to as a One Health problem. As human populations have grown, interactions between people and animals have also changed. Close contact with animals, including domestic or wild livestock and pets, provides opportunities to pass germs between people and animals. For example, Salmonella bacteria can be spread between cattle and people and make both people and cattle sick.
Antimicrobial resistance will go away as we develop new antibiotics. Select submit when done. Knowledge check. Yes, antimicrobial resistance will go away as we develop new antibiotics. How do I? Incorrect. This is statement. This statement is false. Like The miracle of penicillin. Even with new antimicrobials, germs will eventually find ways to become resistant. Developing new antimicrobials takes a tremendous amount of research and requires approval from the U.S. Food and Drug Administration, or FDA, before making it to the market. That is why we need to be assertive in our approach to preventing infections and decreasing the need for antimicrobial use. We also must make sure that antibiotics are used wisely, correctly, and only when needed.
So, it seems clear that antimicrobial resistance is a problem, but the question remains, how does this affect healthcare, my patient, and me as a nurse? Select each option below to learn more.
So, nurses have been described as antibiotic first responders, essential communicators, coordinators of care, as well as 24-hour monitors of patient status. Safety, excuse me, and oh my goodness, excuse me. Safety and response antibiotic therapy. Nurses have long been integral to hospital quality and safety initiatives and are uniquely situated to prevent antimicrobial resistance. These include prevention actions you take whenever you provide patient care, like cleaning your hands, disinfecting equipment between uses, and selecting the right personal protective equipment for tasks you do. Healthcare. Okay, resistant germs are difficult to treat. Imagine taking care of patients like Ann Miller and watching them suffer or perhaps die because there are no antimicrobials available to treat them. People who have resistant infections may be in the hospital for an extended period and may require frequent visits to their health care provider. This results in higher costs for them and the healthcare system. In a recent study, Nelson and colleagues found that in 2017, the annual national cost associated with six antibiotic-resistant bacteria exceeded $4.6 billion. Individuals with resistant bacteria or fungi may also suffer with pain, disfigurement, and multiple surgical interventions. Hospital onset infections can be prevented by nursing adherence to infection prevention actions. Hospital adherence. Okay, patient. Modern medicine is threatened by antimicrobial resistance. The success of life-saving advances such as transplant medicine, cancer treatment, and end-stage kidney disease care are dependent on available tools, including effective antimicrobials. Yet, these modern advances we count on to provide a high quality and longer life are only possible when we have the necessary tools and resources. Those tools include antimicrobials.
Developing an awareness of where these germs live and taking action to prevent them from moving about in the healthcare environment can keep them from spreading. Additionally, collaborating with infection preventionists to screen patients for prevalence studies, advocating for appropriate diagnostic stewardship, addressing antimicrobial use, and communicating with the interdisciplinary team are important nursing actions. In recent research studies, nurses were surveyed about their knowledge and attitudes about their role in preventing antimicrobial resistance. Nurses are central communicators among ordering physicians, the pharmacy, the laboratory, discharge planners, and consulting physicians. Two reviews published in 2021 examined the role of nursing in antibiotic stewardship. Together, these reviews included more than 90 papers. These reviews concluded that nurses have knowledge gaps about antimicrobial resistance and would benefit from evidence-based education. Appropriate administration of antibiotics and documentation about the effects of their use can be improved. These reviews further noted that evidence-based practices were important aspects of the nursing role, but may need to be improved, and adherence to these policies were important. These findings, among others identified by the American Nurses Association and the Centers for Disease Control and Prevention, helped inform this education module on antibiotic resistance. To fully appreciate their role in combating antimicrobial resistance, nurses must stay up to date about antimicrobial resistance, and ways they optimize the use of antimicrobials. Staying up to date with knowledge about antimicrobial resistant germs can be a challenge. It is important for nurse educators to collaborate with various interdisciplinary partners, including but not limited to infection preventionists, pharmacists, and infectious disease experts to provide up-to-date education upon hire and periodically during in-service trainings or skills days. Nurses' understanding of how to prevent antimicrobial resistance allows them to contribute to the interdisciplinary team and advocate for patients effectively.
True or false? Antimicrobial resistance threatens modern medicine as we know it. Of course, yes, it threatens modern medicine as we know it. Correct. This statement is true. Antimicrobial resistance may threaten modern medicine as we know it. Millions of people rely on antibiotics to treat and prevent infections. If antimicrobial agents become ineffective, it may make it difficult to protect patients from infections and cause increased harm and deaths. Antimicrobial resistance is not a problem. False. It is a problem. Correct. This statement is false. This statement is false. This statement is false. Antimicrobial resistance is not a problem in healthcare facilities is false. Several research studies that show that nurses need more information about antimicrobial resistance and their role in combating it. This includes increasing their basic knowledge, comprehending and implementing evidence-based practices while working with an interdisciplinary team, and more. Nurses can influence and prevent antimicrobial resistance. True, of course. We have the power to influence them because nurses can prevent antimicrobial antimicrobial resistance by taking infection prevention actions like triaging patients with symptoms of infection during the admission process so that early isolation is implemented. That's so
In
true.
this section, we will discuss nurse opportunities during the admission process. We will cover medication reconciliation, reporting by taking a comprehensive allergy and antimicrobial history, timing, by looking at appropriate triage and isolation during admission, and the timely initiation of prescribed antibiotics. We will look at communication and transparency, and lastly, we will look at how to develop a script for nurses. Select each section to learn more.
Okay.
Medication reconciliation, including antibiotics, is particularly important because the patient may be at risk for resistance or illness, like C. diff, if they have taken antibiotics in the previous month. During the medication reconciliation process upon admission, nurses should ask the patient, "Have you taken any antibiotics?" The answer to this question should be clearly documented in the patient medical record.
Medication reconciliation, including antibiotics, particularly important because the patient may be at risk for resistance or illnesses like C. diff. Yes, that's true. If they have taken antibiotics in the previous month. During the medication reconciliation process upon admission, nurses should ask the patient if you've taken any antibiotics. The answer to this question should be clearly documented in the patient medical record. Yes, it's very true. I've encountered one patient who's been taking medications previously before she was admitted. But then again, after 1 week of using one antibiotic, of course, we've discovered that she's developed resistance against that particular antibiotic. It's very expensive. And the only thing that made us sure that she's developed resistance, aside from her temperature not going down, is because of the result of the lab exam. So, of course, upon admission, it's a prerequisite for the ER staff personnel to collect blood and to take several laboratory tests. And after testing, we've realized that she has gained resistance against that particular antibiotic. So we had to change the antibiotic again and start 7 days process, another 1 week for her to stay in the hospital. Blood culture.
In
Yeah.
addition to the admission process, there are several actions nurses can take throughout the hospital stay. These include communicating with the interdisciplinary team, monitoring for adverse events, ensuring appropriate antibiotic delivery, and patient education. We will review each of these in the next few slides. The nurse may be the first member of the team to receive culture results from the laboratory. Prompt communication about the patient's pathogen between the pharmacy and clinical team is essential to determine if the pathogen is sensitive to the antibiotic or not. Ultimately, the goal is to make sure that the appropriate antibiotic is prescribed. These communication efforts can occur during team rounds, on the phone, or via the electronic medical record. Keep in mind, some nurses may not feel empowered to participate in the interdisciplinary team. In a 2018 survey, 180 hospital nurses reported that clinical practice and hospital culture influenced perceptions of the nursing role in stewardship. It was reported that barriers to stewarding included nurses not included in rounds, interdisciplinary power differentials, and nursing input not actively sought. However, in a 2020 quality improvement study, decreased antibiotic use was reported when nurses used a script to prompt the provider about discontinuing an antibiotic. It is important for nurses to see examples of how they can impact antimicrobial resistance, and to increase their knowledge and abilities to become active members of the interdisciplinary team. Patients are treated empirically, while various diagnostic and laboratory tests are being conducted to determine what is causing the illness. Sometimes, providers and the team do not revisit the selection of the antibiotic after these test results are available. Enter antibiotic timeouts. A core practice in improving quality and avoiding errors. The interdisciplinary team should perform a review of antibiotics 48 to 72 hours after antibiotics are initiated to answer these key questions. 1. Does this patient have an infection that will respond to antibiotics? If so, is the patient on the right antibiotics, dose, and route of administration? Keep in mind, during a timeout, the team pauses to reassess the continued need and choice of antibiotics when the clinical picture is clearer and more diagnostic information is available. And 2. How long should the patient receive the antibiotics? The specific clinical effects of antibiotic timeout are not well documented, but research studies have identified that the antibiotic timeout can improve the selection, duration, and use of some antibiotics. Hospitalized patients are almost always initially prescribed intravenous antibiotics. Oral antibiotic therapy can be just as effective as intravenous, costs less, and may even result in an earlier discharge. Nurses work closely with patients and are aware of when patients can tolerate fluids, food, and pills. The nurse plays an important role in keeping the team informed. Another important nursing contribution to the prevention of antibiotic resistance is the monitoring of adverse events. Around 50% of hospitalized patients receive antibiotics, and as many as 20% experience an adverse event associated with those prescriptions. As nurses administer antibiotics and monitor their patients, they are often the first healthcare provider to detect an adverse event. These events can be avoided by appropriate prescribing and monitoring use, but nurses should be careful to document adverse events that may be associated with antibiotics, such as gastrointestinal, renal, and hematologic abnormalities. Nurses should communicate these events to the interdisciplinary team.
All right.
As we just mentioned, antimicrobials may not be compatible with other medications the patient is taking. Most interactions of antimicrobials with other drugs have to do with how they are absorbed, distributed in the body, localized in the tissues, and excreted. For example, aminoglycosides, such as gentamicin used to treat gram-negative infections, are excreted through the kidneys. This class of drugs may be incompatible with other drugs that are nephrotoxic, such as anti-inflammatory drugs, radiographic contrast, and some chemotherapies. Developing a script may help nurses feel more comfortable helping patients understand more about antibiotics, especially as a part of the discharge education. Select each chat bubble to learn more.
This is an antibiotic. Your provider prescribed it because you're taking it for. You need to take this exactly as prescribed. You should not skip doses. You should not save some for later. You should not share your antibiotic with others. You may have some side effects, including if you have any of the following side effects or symptoms, you should call your provider.
Discharge from the hospital.
Oops, wait,
Developing a script may help
this
nurses
is
feel more comfortable helping patients understand more about antibiotics, especially as a part of.
So this is example two. Taking antibiotics may interfere with other medications such as Coumadin, which is also known as warfarin. Tell your provider about other medications you're taking. Ask your healthcare providers if this antibiotic will interact with any other medicines, vitamins, or supplements. Example three. If the patient was not prescribed antibiotics and asks why, the nurse might choose to say, there are some things that don't get better with antibiotics. That is why your provider didn't prescribe an antibiotic. What you can do to feel better is.
Discharge from the hospital or medical facility is another important healthcare transition that may prevent antibiotic resistance. Nurses are often the last healthcare provider to interact with the patient before they go home. Nurses, therefore, have an important role in making sure appropriate instructions, follow-up, medication reconciliation, and education occurs at discharge.
All right.
Nurses should teach the patient and family that the patient should not stop taking an antibiotic unless their provider tells them to, even if they feel better. Nurses should teach patients 1. To not use more medicine than directed. 2. To not share their antibiotics with anyone, and 3. To not take extra doses of their medicine to make up for a missed dose. In the event of a missed dose, patients should take it as soon as possible. If it's almost time for their next dose, wait and take the next dose as scheduled. While it is recommended that these aspects are taught upon discharge, it is important to provide information throughout the admission, and in writing, so the patient can refer to it for questions. Incomplete or ineffective antimicrobial information at discharge may result in non-adherence to the medication, readmission to the hospital, antimicrobial resistance, and other complications. In a 2020 study, it was reported that 41 to 78% of patients leave the emergency department with insufficient information. While multi-pronged approaches to patient education, including providing instructions in writing, are effective, written instructions do not address cases of low health literacy. Teach-back methodology is not only to verify patient recall, but also their understanding by asking them to repeat the given discharge information in their own words. The healthcare provider can then correct inaccurate information, if necessary. Learn more about the teach-back method by selecting the button here. Select the question sheet button to learn. In a study published in 2020, an emergency department discharge teach-back conversation took 1 minute and 39 seconds per case, versus an average of 3 minutes and 11 seconds for a regular discharge interview control. They concluded that the teach-back methodology was an efficient and non-time-consuming method to improve patients' immediate and short-term recall, as well as comprehension of discharge information in the ED. This approach may also be effective in many other settings.
Yes, teach-back method is very helpful and effective. Multiple choice. Which of the following is not the role of the clinical nurse in combating antibiotic resistance? Select, submit when done. Not. So we're looking for not role. Okay. Addressing AR during the admission process. Yes. We have to do that. Discussing AR with the interdisciplinary team. Yes, that's our job. Telling the prescriber which antibiotic to order. No, it's not. It's not our job to do that. Provide patient education, of course. Coordinating the discharge process. Of course. Coordinating the discharge process. Correct. Telling the prescriber which antibiotic to order is not the role of the clinical nurse. Staff nurses do not. Wait just a moment. Oh, just a moment. So Staff nurses do not prescribe antibiotics. However, nurses do play an important role on the interdisciplinary team in helping with administering antibiotics as soon as possible after the order, making sure that any cultures that are needed are done before delivery of antibiotics, and working with a team to balance diagnosis and early antibiotic intervention to help deliver safe, high quality care. Okay. All right, let's click continue. All right. Oh, wait. Okay, we've answered that. Is there? Okay, true or false? Not all nurses are comfortable discussing antibiotic resistance with the interdisciplinary team. True or false? Not all nurses, meaning to say a few, are comfortable. Is it a few are comfortable? It should be all nurse, right? Wait, using a script. Oh, okay. Can I answer again? Submit and then next. So the answer is false. Not all are comfortable. Sorry, I forgot. The correct answer is true. Using a script may help the nurse feel comfortable. How about feel more comfortable about participating in antibiotic resistance conversations in interdisciplinary rounds? A 2020 report by Ray Barden and colleagues found that when critical care nurses developed a standard script to incorporate a number of days the patient had been receiving antibiotic therapy into nurse rounds with scripts to communicate the information to prescribers, they saw a statistically significant decrease of antibiotics in the ICU, and importantly, no significant patient adverse
A few key
reaction.
takeaways from this module. Antimicrobial resistance is a One Health problem that affects people, animals, plants, and our shared environment. We can work individually and collectively to combat antimicrobial resistance. These actions can protect you as well as your patients. Remaining aware and practicing infection control, like using the right personal protective equipment for the task, and communicating the need for precautions to others, can help stop the spread of antimicrobial resistant organisms in healthcare settings.
Yes, that's true.
Good communication between units and facilities is essential to promote safe infection control practices across various healthcare settings. We have come a long way since the miracle drug, penicillin, saved Ann Miller, but we still have a long way to go to make sure that we guard this precious resource, antibiotics. Nurses play an important role in antibiotic stewardship. Nurses can and will continue to make a difference by collaborating with interdisciplinary partners and caring for patients, now and in the future. Congratulations! You have completed the antimicrobial resistance, the role of the clinical nurse module. You may now exit the course.
All right, there you go. That's the end of the course. And how are we gonna print verification of completion? Complete the verification completion checklist before moving on to the course evaluation. Click to visit and content is now available. So where is it? Verification completion. Open checklist. By clicking this box, I verify that I have completed the requirements for successful completion to earn the full contact hours awarded for this program. Save successfully. Okay. And then once I'm done, course evaluation. Please complete the course evaluation. The evaluation survey must be completed to obtain a course certificate. We appreciate your thoughtful feedback. The course evaluation will become available only after verification of completion is submitted. Course evaluations. This a quiz. ANA Project First Line Module. I participated in this nursing continuing professional development activity for the following reasons. To support re-licensure, yes. To support certification research. certification as a foundation to learn more about the topic, to validate my current practice, to advance my career. Has your understanding of the topic improved after? Yes, of course. The content of this activity, the content in this activity provide information that will assist me in changing or improving my practice, of course. Please indicate one or change improvement you plan to make to your practice based on participating in this activity. Mm, I will definitely practice the teach back method to my patient as they are discharged from my care or from the hospital to ensure better understanding of their home medications and to answer any clarifications that they may have. What is your professional role? I'm a registered nurse. Okay. How satisfied were you overall with the product or service you received? 10. I'm very satisfied. How likely is it that you would recommend American Nurses Association product? 10. On a scale of 1 to 5, 5 being the highest, please rate the following: quality of course materials, 5; learning platform, 5; registration process, 5. Please provide any feedback about the course here. Thank you so much for a very informative course. Who referred you? Who referred me? No one referred me. Anyway, submit. There was an error. Which part? Who referred me? College, academia. NA project first line module, 100%. Yay. Okay, I think I'm done. Upon completion of the required course elements, your course certificate may take up to 5 minutes to process. You will receive a notification once the certificate is available. Click the link below to retrieve your certificate. The course certificate link will become available only after the course evaluation is submitted. I've already submitted it, right? Huh? So wait. Mm, wait, I have to repeat again. Why? Did I miss something? I will definitely practice. Thank you for having that. Nurse, I'm a registered nurse. Wonder why. Which of the following designations where you work? Long-term care facility, inpatient rehab, critical access, hospital, acute care hospital. How satisfied? 10, 10. I'm very satisfied. I'll give perfect score. Further, thank you so much. Who referred you? No one referred me. Okay. Thank you for taking our survey. Your response is very important to us. And then after that, what's next? I just need to wait. Uh, Maybe I should just wait for it. I don't know. For a certificate. Maybe they emailed me. So I'll just check my email and see if they have emailed me. It says it will take a few days for it to be visible. Rakuten. All right, let's see. All right. Okay. I'll just probably wait for my certificate. So we'll see notifications, progress. Maybe it's in here. Oh, congratulations. Yay, there you go. This is it. V certificate. American nurses. Yay. Oh, expiry date. Never. Let's generate the certificate. All right, and it looks like this. Ooh, there you go. I'm so glad I have this, and we can actually just submit this to the Board of Nursing in the future as we renew our license. So this gives us 1 hour, one CPD unit. Yay, I'm so glad. And this is free of charge. Well, we need 15 of this. So we'll see. We also have other courses. So that's, wait, just a moment. How do I share this? My screen. Uh, no, what am I doing? Wait, let me just